President Trump just launched a website he's calling transformative and historic. TrumpRx.gov went live this week with promises of massive drug discounts that would save Americans a fortune. Trump stood in the White House alongside Dr. Mehmet Oz and declared this would revolutionize healthcare in America. "You're going to save a fortune," Trump told the cameras. "And this is also so good for overall health care." The website features 43 medications with eye-catching discounts. Fertility drugs slashed by 93%. Asthma inhalers cut from $500 to $200. GLP-1 weight loss drugs like Ozempic and Wegovy available for cash prices. The administration is calling it the biggest drug price reduction in American history. But here's the problem. Experts are saying most Americans won't actually benefit from this at all. In fact, for the vast majority of people with health insurance, TrumpRx might actually cost them more than just using their regular coverage. This is the story of how a heavily hyped government website might deliver far less than promised. Why the biggest pharmaceutical companies are surprisingly happy about it, and what this reveals about Trump's approach to actually solving America's healthcare crisis. Let's break down what's really happening with TrumpRx. The promise. The White House fact sheet reads like a healthcare miracle. Trump negotiated what they're calling most favored nation pricing deals with 5 major pharmaceutical companies: Pfizer, Eli Lilly, Novo Nordisk, AstraZeneca, and EMD Serono. More companies are supposedly joining soon. The discounts sound incredible. Gonal F, a common fertility drug, drops from over $800 to $168 per pen. Cetrotide, another fertility medication, falls from $316 to just $22.50. That's a 93% discount. Bevespi Aerosphere, an inhaler for COPD, goes from $458 to $51. Air Supra, an asthma inhaler, drops from $504 to $201. Insulin Lispro becomes available for as low as $25 per month. These are real price cuts. Nobody disputes that. The question is, who actually benefits from them? The reality. Here's where things get complicated. TrumpRx doesn't actually sell you drugs. You can't buy medications directly from the website. Instead, it functions as what experts call a facilitator or landing page. When you search for a medication on TrumpRx, one of 2 things happens. Either you get redirected to the pharmaceutical company's own direct-to-consumer website, where you can purchase the drug at the discounted price, or you get a printable coupon to take to your local pharmacy. But there's a massive catch. These discounts are only available if you pay cash, out of pocket, not through insurance. In fact, when you access certain discounts on the site, you have to click a button confirming that you're not enrolled in government insurance programs like Medicare, and that you won't seek insurance reimbursement for these purchases. You also agree that these costs won't count toward your insurance deductible or out-of-pocket maximum. Dr. Ben Rome, a health policy researcher at Brigham and Women's Hospital in Boston, put it bluntly to NPR. This is a website that has undergone a lot of hype, but it's not clear exactly how much it's going to help those people who use prescription drugs. And for the vast majority of people, it's going to continue to be less expensive for patients to purchase their medicines using their insurance than it is to pay cash prices. Even the TrumpRx website itself acknowledges this problem. On each drug listing, there's a disclaimer that reads, "This is an out-of-pocket price. If you have insurance, check your copay first. It may be even lower." Think about that for a second. The government's own discount drug website is telling you that your insurance might actually be cheaper. Who this actually helps? So, if most people with insurance won't benefit, who is TrumpRx actually designed for? The answer is a relatively small group. Americans who are uninsured, people whose insurance doesn't cover specific medications, and those who have high deductibles and haven't met them yet. Juliette Cubanski, Deputy Director of the Program on Medicare Policy at KFF, explained it this way. There's no clear advantage for most people to use TrumpRx to purchase their medications. For most people, especially most with health insurance, it would be hard for direct-to-consumer prices to beat the cost-sharing amounts that they'll pay using their insurance. The platform could help people seeking GLP-1 drugs like Wegovy or Ozempic for weight loss, since many insurance plans don't cover these medications when they're prescribed for obesity rather than diabetes. But here's the thing. Eli Lilly and Novo Nordisk were already selling these drugs at these exact same discounted cash prices before TrumpRx launched. Novo Nordisk has been offering injectable Wegovy at cash prices of $199 to $349 for months. Their newly launched pill version was already priced at $149 to $299. Eli Lilly has been selling Zepbound at $299 to $449. TrumpRx didn't create these discounts, it's simply aggregating deals that already existed and presenting them in one place with the Trump branding. The pharmaceutical company perspective. Here's where this gets really interesting. Why would major pharmaceutical companies agree to offer these discounts through a government website? The answer lies in what Trump gave them in exchange: tariff relief. The administration has been very secretive about the actual details of these deals. They've cited confidential business agreements as the reason they won't release specifics. But we know the basic structure. In exchange for participating in TrumpRx and offering most favored nation pricing on select drugs, these pharmaceutical companies received exemptions from certain tariffs. From the drug company's perspective, this is actually a pretty good deal. Here's why. First, they get to choose which drugs to discount. They're not required to lower prices across their entire product lines. They can strategically select medications where they face generic competition anyway, or where they were planning to offer direct-to-consumer discounts regardless. Second, they're encouraging patients to bypass insurance and pay cash directly to them. This might sound counterintuitive, but it's actually beneficial for pharmaceutical companies in several ways. When you pay cash and don't go through insurance, the drug company doesn't have to negotiate with pharmacy benefit managers who demand rebates and price concessions. They get the full cash price directly. Third, when patients pay cash for drugs, those purchases don't count toward insurance deductibles or out-of-pocket maximums. This means patients might end up spending more overall on health care because their cash drug purchases aren't helping them meet the thresholds where insurance coverage improves. Benjamin Jolly, a senior fellow for healthcare at the American Economic Liberties Project, told ABC News, "It's nice that they are aggregating coupons in one place, but the overall impact on drug pricing and the pharmaceutical industry is questionable." The missing context. There are some important facts that TrumpRx's marketing doesn't emphasize. First, 9 out of 10 prescriptions filled in America are for generic drugs, according to the Food and Drug Administration. TrumpRx only offers discounts on brand-name drugs. The medications that most Americans actually use aren't even on the platform. Second, the site launched with only 43 medications. The pharmaceutical industry produces thousands of drugs. Even as the White House promises more will be added, this represents a tiny fraction of the medications Americans take regularly. Third, some of the drugs featured on TrumpRx are already available as inexpensive generics. For instance, Protonix for heartburn and GERD is on the site with a discount. But generic versions of the same drug are widely available at much lower prices. Fourth, the discounts compare cash prices to list prices of drugs. List prices are notoriously misleading in healthcare because almost nobody actually pays them. Insurance companies negotiate much lower prices. So when TrumpRx shows you a 93% discount, that's compared to a price that very few people were ever actually paying. The political calculation. From a political perspective, TrumpRx makes perfect sense, even if it doesn't dramatically change drug prices for most Americans. Healthcare costs, particularly prescription drug prices, are the top economic concern for most U.S. adults, according to recent KFF polling. More than 4 in 10 Americans cite this as their primary economic worry. By launching TrumpRx, Trump can point to concrete action on an issue voters care deeply about. The website exists. The discounts are real for some people. The administration can generate headlines about taking on pharmaceutical companies and lowering drug prices. The fact that most Americans won't significantly benefit from the platform is a detail that gets lost in the initial wave of positive coverage. The White House event with Trump, Dr. Oz, and Joe Gebbia announcing the launch generated exactly the kind of news stories the administration wanted. Trump launches discount drug website, rather than Trump's drug discount website won't help most Americans. This is representative of Trump's broader approach to policy. Rather than pursuing comprehensive legislative reform or traditional regulatory processes that might take longer but have wider impact, the administration prefers to strike individual deals that can be announced with fanfare. Each pharmaceutical company agreement becomes its own news event. Each TrumpRx expansion can be promoted as another victory. The perception of action matters more than the scope of actual impact. The questions Democrats are raising. 3 Senate Democrats sent a letter to the Inspector General of the Department of Health and Human Services on January 29th, raising serious concerns about TrumpRx's legality. The lawmakers questioned whether TrumpRx and affiliated direct-to-consumer platforms will comply with federal law. They expressed concerns about illegal kickbacks, conflicts of interest, and the potential for encouraging unnecessary medication use. There's also been a Freedom of Information Act lawsuit filed by the consumer advocacy group Public Citizen. They're demanding that the Trump administration release documents related to the drug pricing deals, because so much remains unclear about what pharmaceutical companies received in exchange for participating. The administration has refused to provide these details, citing the confidential nature of business agreements. But this secrecy makes it impossible for the public to evaluate whether American taxpayers got a fair deal in this exchange of tariff relief for drug discounts. The bigger picture. TrumpRx reveals something important about how this administration approaches complex policy problems. Rather than working with Congress to pass comprehensive drug pricing reform, rather than using regulatory authority to impose broad price controls, rather than negotiating with the entire pharmaceutical industry simultaneously, Trump prefers individual company-by-company deals. This approach has advantages. It's faster. It generates positive headlines. It allows the president to claim personal credit. Each deal can be framed as Trump personally negotiating lower prices for Americans. But it also has significant disadvantages. Individual deals benefit whoever happens to get one, while leaving everyone else behind. They lack the transparency of legislative processes. They create winners and losers based on which companies agreed to participate, rather than based on which drugs Americans most need to be affordable. Most importantly, they don't address the underlying structural problems that make American drug prices higher than in every other developed nation. What happens next? The Trump administration says additional drugs from more pharmaceutical companies will be added to TrumpRx in the coming months. 16 companies have reportedly signed Most Favored Nation agreements, though only 5 are represented on the site at launch. The administration is also pushing Congress to pass what Trump calls the Great Healthcare Plan, which would codify savings from the Most Favored Nation pricing initiative, lower insurance premiums, and increase price transparency. Whether Congress will actually pass such legislation remains uncertain. Healthcare reform has proven notoriously difficult, even when the same party controls both chambers of Congress and the White House. Meanwhile, the direct-to-consumer prescription drug trend that TrumpRx represents is likely to continue growing. Companies like GoodRx, which is actually a key integration partner for pharmaceutical companies offering discounts through TrumpRx, have been expanding this model for years. The question is whether this model actually serves patients' interests or primarily serves pharmaceutical companies' interests by encouraging people to bypass insurance and pay cash directly to drug manufacturers. The bottom line: TrumpRx is real. The discounts are real. Some Americans will genuinely benefit from this platform, particularly those who are uninsured or whose insurance doesn't cover specific medications they need. But the historic and transformative rhetoric doesn't match the reality of limited impact for most Americans. The website launched months late after multiple delays. It features only 43 drugs out of thousands. It only helps people paying cash, not people using insurance. Many of the discounts were already available before TrumpRx existed. And the pharmaceutical companies who agreed to participate got tariff relief in exchange. This is classic Trump deal-making applied to healthcare policy. It produces something tangible that can be announced and promoted. It creates winners who will praise the program. But it doesn't fundamentally restructure the systems that made American drug prices the highest in the world. For millions of Americans struggling with healthcare costs, TrumpRx might look like a solution. But for most people with insurance, the advice on the website itself says it all. Check your insurance copay first, because it's probably cheaper. That's not exactly the healthcare revolution the White House promised.